Okay, we're another moment. I like to cross the 100 threshold. We just did so. Welcome everybody. I'm Lyle Hanna. We've got a great agenda for you today. Crisis management for COVID-19. Here we go again. We think we're on phase 33, but honestly, we're starting to lose count. We've got some super guests here today, and I'm excited to introduce Jim Gray is going to kick it off. All of you know that he's the past mayor of Lexington, and he's the head of transportation for the state. He just got a new bridge built in Cincinnati. That was a big deal. Good work, Jim. And now you're taking over distribution of vaccines for the COVID-19. Jim, he's on a tour right now of the facility over at in Louisville, UPS World Center. They're doing vaccines every day. Jim, welcome. We're glad you're here. We're going to let you jump right in and say a few words. And I know you're going to pitch over to Bonnie, and we'll introduce her when she's ready.
Okay. Hey, Lyle. Hey, listen, thanks so much. And welcome, everybody. Thank you all for allowing me to join you today. It's like Lyle, you all know Lyle Hanna well, and you know how persuasive he is. I said, I've got a 11 o'clock meeting that starts in Louisville. I'm doing a tour of UPS's World Hub, where the vaccine is being distributed to majority of the East Coast right out of Louisville. And that's both Pfizer and Moderna vaccines. So I'm going to see the refrigeration systems and the full distribution system that they've got operating here. Actually, Lyle, it's been described by UPS as the world's largest single distribution project, logistics project in world history. And so getting a sense of what this represents, you know, we just heard that this past week that Pfizer is moving up its production of 200 million vaccines. The goal was June. They've now moved it up to May, and are just the news today, just this morning, was that they're expecting to double their manufacturing capacity. Well, that's clearly all good news, because I've been saying for the last 3 weeks that the three most important words in this project are supply, supply, supply. The good news is that Kentucky is 18th in the country today in terms of the number of vaccines, the ratio of vaccines in arms to what we have been allocated. And what are those numbers? Well, as of Friday, those numbers are 442,000 unique individuals have been vaccinated in Kentucky. Now, what does that represent in terms of the percentage of our population? We're at just between 4.4 and 4.5 million citizens in Kentucky. And that's everyone. So that's roughly 10% of our population has been vaccinated already. And that's when supply has been constrained. We were getting 56,000 vaccines a week up until a week ago. Last week, we got 65,000, and we were actually vaccinating more individuals, more of our citizens than we were receiving allocations. And that was simply because we had a backlog. Now we've actually taken that backlog off the table, and we are now all of what we're getting allocated is being the vaccinations are occurring. Now, when I say all, I'm thinking very close there. We're at 90% of the allocations we are receiving are shots in arms, and that's occurring. And here's a slide that illustrates that. 90% of the first doses received have been administered. So a very modest amount of backlog or allocation that still has to be administered. Our goal is 90% of the vaccines that we receive are in arms within 7 days. That's the governor's goal, and we are right on target with that goal. One thing before I turn it over to Bonnie, so I can get onto this tour that I'd committed to before Lyle called me, I wanted to say that we're hoping that folks will continue to have patience. With the number of vaccines that we're receiving today, that's a little over 60,000. That would take a long time. That would take as much as a year or longer, especially with 2 vaccines. Our target population that we're trying to hit in terms of number of vaccines, population that we're trying to target is roughly 2.5 million of our citizens, and 2.5 million out of 4.5 million. If you dial back to the H1N1 vaccination in 10 years ago, only 25% of Kentuckians actually received the vaccine, took the vaccine. So clearly those numbers need to improve in order for us to get to herd immunity. And that's what Dr. Fauci has actually set as a goal, the end of the summer, that we would be at herd immunity for the whole country. So if I look at it this way, I'm saying if we vaccinate, if we can double the vaccinations to a little over 100,000, 120 to 150,000 a week, that takes us to a solid number on a monthly basis, close to 600,000 a month. And if we hit those numbers, then we will achieve the target of herd immunity toward the end of the spring and early summer. Well, we'd get there by the summer. So I'm going to turn it over to Lyle. I'm going to turn it over to Bonnie now. And thank you very much for inviting us to join you all today. You got a great group, always do, and it's a real privilege to be invited to join with you guys, with you all. Thank you so much.
Thank you, Jim. Keep up the good work, man, and let us know how we can help. We appreciate it.
Thank you, sir.
And we're delighted to have Bonnie here.
Hi, it's Bonnie Hackbarth. You guys had Hackworth on the slide, so I just want to correct that. It's Bonnie Hackbarth. I'm worth it, but it is Barth.
and Bonnie has a great background. She actually works for the Foundation for a Healthy Kentucky, and she's the vice president of external affairs. But like everybody, she's been pulled into other things. So now she's the communication strategist for the vaccine distribution. So she and I've been back and forth all weekend, kind of getting ready for this. And we're so glad you're here. We've got a slide with your photo on it, but you probably want to carry on with these slides, right? And talk about this. So
yeah, let's move to the next slide, and I'm ready to go.
Okay. And Jim, we thank you so much for joining us.
Thank you.
You're well backed up with Bonnie.
There you go. You fixed it. Thank you so much. Okay.
I want to make sure that we fixed it as soon as we heard what it was. So we went in and
I appreciate it.
So there you go.
Okay, well, we're ready for the next slide. There we go. So as Secretary Gray said, that this is a really complex logistical project. And if you go to the next slide, I'll kind of explain a little bit why that is. We've got 2 different vaccines. Both require refrigeration, but one of them requires a super cold freezer that most sites don't have. They have 2 doses each, but one is 3 weeks after the first dose. The second one is 4 weeks after the first dose. And there are several other complications that make this very, very logistically complex. And so lots of different things are going into the algorithm. But as Secretary Gray said, the supply remains very limited at this time. It's not supposed to go down from here on out. We're supposed to get more and more, but at this point, it's still very limited. If we were, right, in February 1st, the week of February 1st, we got 68,000 doses of vaccine for the entire state of Kentucky. And if we were to vaccinate to herd immunity, we would have to take about 15 months to do that at that supply level. And so when you hear concerns from people that they couldn't schedule their appointment, it's merely a matter of not having enough vaccine. We had one local health department, for example, they had 500 doses that they were able to give out, and they got over 50,000 calls for those 500 doses. And so that's why Secretary Gray was talking about patience and supply. We are, however, going to be ramping up so that when the supply increases, we are ready. So here's another complication to the logistics here. We have 61 local health departments in Kentucky. Some of them are single county health departments, and some of them have 7 or 8 or even 9 counties that they cover. If we were to give the minimum dose a supply, which is 100 doses of the Moderna vaccine, if we were to give that to every single county in the state, proportionally, we would give 100 doses to the smallest population county in the state, which is Robertson County. To do that in the largest county in the state, we would have to give them 36,000 doses. And we have 120 counties. So you can see that we just don't have the supply to do that. But Commissioner Stack did announce last Thursday that in addition to these regional sites that we're setting up, which are high capacity sites that people can drive to, go in, get their vax, come back out, we recognize that there are people who are homebound, people who aren't able to drive. So we're also working with those 61 local health departments. And each of them this week and for the next 2 weeks after are getting an allocation of vaccine equivalent to 100 doses for every 1% of the population in the counties they cover, rounded up. So for instance, little Robertson, which has 2,100 people, would get 21 doses, but that's rounded up to the minimum of 100. But they're a part of the Buffalo Trace District Health Department. So then Mason County would get its supply, and together the Buffalo Trace District Health Department would determine how to distribute those vaccines in their community. As Secretary Gray said, we need to vaccinate about 70 to 80% of Americans to achieve herd immunity. In Kentucky, that's between 2 and 2.4 million Kentuckians. Next slide, please. So we are identifying new both local and regional sites every single week. The week of February 8th, we announced the new Horse Park Regional Site. You can see that right here. It's the green dot. And then we also did Ephraim McDowell, and we did 2 sites over in Paducah with the 2 hospitals there. So that was the week of February 1st. Next slide. Those were announced. Is February 8th. And so we're going, the commissioner announced more sites. We have the 2 there in the Bowling Green area. We've got 1 up in northern Kentucky, and then we have 1 way down there in Callaway County at Murray State University. And then we have the next week is also for this week when the commissioner announced that every health department would get an allocation. And so you can see the shading. In some cases, a health department is a single county. So those are the counties with a single PIN, but in some cases, for instance, the Lake Cumberland district down in the south central area, that's the district for the entire county. So there's only a PIN there in, what is that, Pulaski County, but it will get the doses for every single one of those counties. And then as of February 12th, the president announced that pharmacies would be getting a direct supply of vaccine from the federal government. Walgreens and Good Neighbor pharmacies in Kentucky would be getting a direct supply. So the goal ultimately is that every person, no person would have to drive more than 1 county away to get their vaccine. And of course, if you're homebound and unable to drive, those local health departments will be able to address that. The only county right now that doesn't seem to fit that is down there, Clinton County in South Central in the Lake Cumberland district. But in fact, every county in that district has a bricks and mortar health department site. So in fact, it's possible that the Lake Cumberland District Health Department will be able to ensure that Clinton County gets their vaccines within their own county as well. That is up to that local health department. So this map is considerably filled out compared to just a few weeks ago. And then go ahead and move on to the next slide. And then Kentucky, in comparison to the rest of the nation, we currently rank 19th in the nation for the vaccines that have been put in arms. And you can see there in the pullout box, it says 9.5% of our population. But in fact, if you count what the VA is doing, we are really closer to 10%. So what I would ask you to consider is that we are less than a year from the date the very first person in Kentucky was diagnosed with COVID, and we have vaccinated 10% of our state's population. That is a modern medical miracle that we are able to do that. And the fact that we're waiting on more supply, yes, can be frustrating for some people who want it now, but we are ramping up for that supply so that each of these regional sites that we have announced has far more capacity. In other words, they can put more shots in arms than they're currently doing. And when we get more supply, it'll be seamless to just get them moving to do that vaccination for more people. Next slide. And so here is the distribution plan and the way it looks right now. We have the different phases, which are based on the CDC phasing in terms of eligibility for the vaccine. We are currently vaccinating phases 1A and 1B, with the 1B persons who are 70 and older, the primary prioritization population in February. Now, some persons in phase 1C are being vaccinated right now as well. And the way that happens is each vaccination site is instructed to use at least 90% of the vaccination they receive on usually Monday or Tuesday of each week within 7 days. And in order to do that, they might vaccinate someone who is in phase 1C if they had a no-show or something else happened and they've taken care of all the people in 1A and 1B for that day. And so we don't want to waste a single vaccine. And there's a couple of different ways to waste vaccine. One, you can leave it sitting on a shelf instead of putting it in someone's arm. Or two, once you open a vial that has a certain number of doses, and the dosage depends on which vaccine it is, Moderna or Pfizer, you want to use every dose in that vial, and it's only good for a certain number of hours after you pierce that vial. And so you want to put that dose in a willing arm. And so the priority is 70 and older, and we ask people to really follow that. But do you know, you may hear of someone who's in 1C who got a vaccine, and that's why that happened. We are not going to waste a single dose. So this is the plan so far, and we're, like we said, hoping that by fall we'll see a vast majority of people who want the vaccine vaccinated. Now, it's going to slow down a little bit in this phase 2 and phase 3 stages, and that's not so much because we won't have enough vaccine, but that's when we'll hit that wall of people who are vaccine hesitant or don't want it. And we are definitely planning for that. We are working on a variety of different kinds of messaging targeted to different audiences to help address the questions and concerns that they have about the vaccine and respond to them so that we can get our vaccination rate up to that 70 or 80% that's going to be required for herd immunity. Next slide, please. Here is where people can find more information. We've set up a variety of resources. First of all, there's our main website, which includes all of the information about the vaccine, about our phases, about the plan that was approved by the federal government. how many shots are in arms each week, the percentage of vaccine we've received that we've actually administered, all of those things are there. Now you can either go separately to the second website listed there in the middle box, or there's a gold bar at the very top of the page on that first website that says vaccine. You can just click on that. So either way, we've made it easy to find. And this is specific information about the vaccine. And on that gold bar on the vaccine page, you'll see frequently asked questions. And I work to help update that every week. And it's a compilation of the questions that we receive from a variety of sources, from these presentations when people call, from calls to the call center, from legislators, from a variety of sources. And so we try to really answer those questions because there's no reason to just answer it for one. We might as well answer it for anyone else who might have the same question. And of course, we also have our call centers. The vaccine call center is that first number there. And for persons who are deaf or hard of hearing only, we do have a TTY. So that is where you can get additional information. I did see a question pop up, and I'll go ahead and address that, and then I'll turn it back over to maybe Lyle to ask any additional questions. But one question that popped up is, are you going to use this site or that site? I think somebody said U of L. We have more than 150 site proposals right now. The limit, of course, is vaccine. And we do have a list of criteria that we need to look at. Part of it is, do we already have high capacity sites in one area and we don't need to look at another one? Or is the health department really the most active for those smaller sites? I mean, there are just a variety of factors. And so you can submit a proposal to be a vaccination site, but right now we're limited by supply and we're trying to be equitable in the distribution. So we're reaching those populations that were disparately harmed by COVID, had more deaths, had more illness. And then that also includes following the phases. So, but if you're interested in submitting a proposal, do submit it, but we may not be able to get back to you right away. And ultimately, we may or may not be able to use it because it's based on so many different factors that are going in to the equation about where we actually set up sites. I see a question about undocumented people. The vaccine goes to residents of Kentucky, and we don't ask or rely on whether they are documented or not. This is a vaccine that is intended to not just protect the person who receives it, but the rest of the community as well. And we know that even if you are vaccinated, the vaccine is very effective at protecting you from serious illness from the virus, but you still could get the virus and spread the virus asymptomatically. And so we really need to have everyone vaccinated in order to eventually slow, and our hope is stop the spread of the serious illness. So
Bonnie, I have a question. This is Jim Morris. I have a question for you on the distribution 1ABC. One of the questions that I've been getting, two different questions. One, the essential personnel, which includes, there's a list, and one of them is like the attorneys even, and I have a frustration with certain attorneys going out when they don't have any need to, but that's a personal thing. But there's an essential personnel list that doesn't seem to comport with 1ABC, and the other one is, and I've really been surprised both by the CDC and by the state, that they don't have disabled identified as to whether they're 1A, 1B, or 1C, and then like diabetic, actually, whether it's type 1 or type 2, you're in a different distribution altogether. So is there any clarification? I know it's three different issues.
yeah, but
Essential personnel, how do they fit?
Yeah, they're all related, and I can respond to that. First of all, Kentucky relied on the CDC guidelines, which in themselves were based on the ACIR, which is an organization of experts that came to a series of decisions about how to phase, who to include in the various phases. And so, for instance, your question about type 1 versus type 2 diabetes, that's what the ACIR committee recommended to the CDC, and that's what Kentucky is following.
But where do they fall? Where do they fall in the 1A, 1B? Do you know?
So persons with type 2 diabetes would fall in 1C as a person with a condition that the CDC considers high risk for COVID complications. A person with type 1 diabetes, that disease is not included in the high risk, so that person would qualify for a phase based on their age or their job. So if you aren't one of the specific types of workers included in phase 1, phase 2, or excuse me, phase 1A, phase 1B, or 1C, then it's based on your age. So let's give an example. A person like me who is 59 and who is working from home at a health foundation with no health conditions, no high-risk health conditions, I would fall in phase 2. But let's say I'm an essential worker. Let's say I was a bus driver. I would fall in as an essential worker in 1C. So if you're not listed as a specific type of personnel, let's say you're a K through 12 teacher, you're listed in 1B. All other essential workers that are not listed in 1A or 1B are in 1C. Okay. So we have healthcare personnel in 1A. We have first responders and K through 12 in 1B. All other essential workers are 1C. I'm not an essential worker, so I'm phase 2.
Okay, that makes sense. It was a little confusing because of which disabilities go where, and they weren't listed. So I thought I would.
So a person with a disability, if that disability, there aren't any specific disabilities listed in the high-risk groups for COVID under the CDC guidelines. So that person's eligibility phase would be based on their age and their job.
Okay. Then there is another question. I thought I would jump in just to make it so we get into it. It said, what type of proof, if anything, is required for a 1C essential worker?
Yes. So when you check in at the desk, you're going to have to present some kind of ID that shows that you are the person who has the appointment. And so our recommendation, there's not going to be any requirement, and we are relying on people's honesty. But in order to reduce any potential problems, our recommendation would be to bring maybe your work ID, maybe a letter from your employer, maybe wear your uniform. Just make it easy for the person checking you in to see that, in fact, you are an essential worker. That way, it makes it easier for everyone. I see a question here. Do the side effects differ between the Pfizer and the Moderna? If you go to our website, the kycovid19.ky.gov, and you'll find fact sheets for both of those vaccinations. We are not hearing of significant differences, but each person is an individual. And so you can look at their detailed fact sheets. And I would also add that if you have any special condition or concern based on the phases and your particular situation, do consult with your primary care or your healthcare provider, because that will be the person who knows your health situation best and can make the best recommendation for you. We here at the state level are not able to dig into your medical records. That would be a HIPAA violation, and it would be best if you go ahead and consult with your own healthcare provider to make sure that you're making the best decision for you. However, we have said that the side effects are very minimal. You will probably have some side effects. Your body is mounting a defense. It's like a workout for your body. You're mounting a defense to a disease. And it's going to take a little bit of a workout. So you might have some soreness at the site of the shot. You might have some body aches or even a fever. But you cannot get COVID from the vaccine at all. It is not possible. And if you do get COVID between the vaccine and your first dose and your second dose, you were already exposed and going to get it. And the hope is that the vaccine will make your symptoms less severe if it's had a chance to get working.
Great. Bonnie, thank you.
You're so welcome.
Excellent follow-up on all these questions. Whoops, if something else just jumped in there.
I saw it, but it disappeared. So can you see it?
It said, I work in K through 12. If I have a staff member who cannot get the vaccine this week when the rest of the district is getting it due to having a medical procedure in the next couple of weeks, once they're cleared after the procedure, would they still be able to sign up for a vaccine since they were in Group 1B to start with, or will they now need to wait until their age phase?
No.
So in other words, if you missed your phase, can you go ahead and skip the line and still get in? I guess it's kind of the gist of it.
Phases 1A and 1B are now eligible and will be eligible from here on out. We encourage you to get it during your phase, but in this situation where the person has a particular reason that they cannot, what I would encourage them to do is to reach out to their local health department's website and see if they can schedule an appointment there, since they won't be able to get it where their K through 12 school is getting it, and see if they can schedule it there. And just explain the reason. Say, hey, I am a teacher or whatever, and I had a medical procedure, couldn't get it when my school got it. May I go ahead and schedule it now with you? And the health department will either help you schedule it, or we also have the regional sites now, and you can go online and schedule there. If you are 1A or 1B in February, you should be able to get a slot as vaccination supply allows, but you will not have to wait for your age.
All right, Bonnie, super. And by the way, last week I got a tip that I'm in 1C, so I signed up and I did it on the Kroger site, but I couldn't get on it first. But then I got a tip that I ought to try 12:01 a.m. And sure enough, my wife tried it at 11:50, wouldn't work. 12:01, got on, got the first shots of the day. We went out this last Saturday to the horse park, to the Alltech Center. It was very easy. And in fact, it was 46 minutes from the time we entered the building to the time we exited. And 15 of that is waiting after your shot to make sure that you haven't passed out or something.
Yeah.
Bad side effects.
Yeah.
But
it's a little bit different time each day that Kroger opens the new sites. It's on a rolling 7-day schedule. So on Thursday of this week, I'll be able to start scheduling for Thursday of next week. But it's a little bit different time. And again, please just have patience. If you can't get on, it's only because the demand far exceeds supply at this point. And remember that even after you're vaccinated, you still need to wear your mask, social distance, do the hygiene recommendations, because even if you are vaccinated, you still could contract the virus and spread it. And you want to protect others as well as yourself and your loved ones. So wear your mask. And when we achieve herd immunity, that's the time at which we'll all be able to start easing those restrictions, but not until.
All right, Bonnie, thank you so much. We appreciate it. And we'll be in touch. Don't hesitate to reach out to us if we can help you anyway.
Thank you so much. Appreciate you.
You bet. I asked Jim to put this other slide up because I kind of wanted to get rolling early as this program started, because Jim Gray was in a big hurry, and it was great. But I want to mention that we've added somebody as effective this morning. Angie Bailey has joined our team. Many of you know her. She's from Louisville. She's been working in HR for many years, very active on the Kentucky SHRM board and other things in the community, including Greater Louisville Inc. Oops, GLI. Whoops, excuse me, Greater Louisville Inc. And we're just delighted to have her. So she's on the call today. I'm glad to see so many people. Goodness gracious. I wish I could stop and say hi to all of them, but let's march on because Jim has a lot of stuff to cover. Jim, so glad you're on here. I know you've just been, it takes a lot of prep to get this stuff ready. So lead on.
It does. So let me go through some things with you. I'm going to stay Kentucky-centric for a little bit, and we're going to roll through, and then I'm going to do some federal. Then I may come back to Kentucky if we run out of time or if we have more time. There's a tremendous amount of information out there, and I do have a little bit of follow-up on the vaccine, COVID, other things from the CDC, because there's a really cool report they started releasing last week, state by state. So we'll cover that in just a second for some of the curiosity of things, not necessarily the legal aspect. So here we go. I want to share this with you. I put a typo on here. It says 118. It's actually 110. So a month ago, today, basically, 28 days ago, this is where we were. We had one orange, way down in western Kentucky, all red.
There are only 3 people in that county, so.
That's right. So this is where we are today. Well, actually, this is yesterday because the system would not work today. Luckily, I go through and make a copy the day before just in case there's a problem. The KY COVID website has a dead link on the pictures or on the map for Kentucky. So this is as of today. So you look at last month, you look at today, we're trending in the right direction. So just FYI where we are, if you are in a red county, you're still subject to the red zone reductions. This is, you have to allow your employees to work from home when it's possible. There is no governmental offices open unless they are critical. To reduce your in-person shopping, order takeout, don't go to restaurants, prioritize businesses, so on and so forth. I'm not going to read each one, but just keep in mind where you are with this. Now, there's a little bit of an interesting thing we're going to talk about here in just a second. Actually, I'm going to do it now. Let me grab this and bring it over here. Whoops, where'd it go? 1 second. Let me grab it. There we go. It won't go. Move. All right. Huh.
Well, do the old-fashioned way. Tell us about it.
Well, here we go. I want to share it with you because this is the CDC website, or the state Kentucky report. It's available on their website. So let me scroll down to a couple of things on here. So if you want to know where we stand in terms of the state, it has that information on the page. It talks about changes from previous weeks and so on. There's a whole lot of interesting things. There's also saturation on this, meaning it is insane how many statistics they put on this document. I'm not going to cover it all with you. I'm going to just cover a few highlights because it does get a little, it's very important on certain parts. So new cases, you see it started to spike. Now we're trending down. That was the end of the year last year to right now. In terms of the hospital administrations, it's showing a higher level here. Also with the age statistics and so on, there's some information that you may want and may not want. This is why I pulled it up right now. I don't know how they figured out yellow versus red. And there's also another thing I just had to laugh at, which is if you know Lexington, Fayette, Urban County government and Louisville Metro, Louisville is now the county and the city are one and the same. Same thing with Lexington. Fayette County, Lexington, Fayette, they're the same thing. So when you look on here, localities in red, Lexington, Fayette is in the red, but Fayette is in the yellow. I don't know who's doing this or orange, but that shows that at least for Fayette County, I can't speak to Jefferson because they're both in the, if you look at the very first one at the top, Jefferson County and Jefferson locality are both in the red. Lexington Fayette is in the red, but Fayette County is in the orange. But you'll see here, oranges are going up, but that's because the reds are going down by 17, so it's a little misleading. So they've got this broken down by area as to things that are starting to turn yellow and orange. I don't know who's more up to date and who's not, because I would think that Fayette County turning orange would be something that the KY COVID website would have on there. There's a whole lot of other statistics on here talking about daily cases, the state profile. If you look where we were in the past versus now, they've got a whole lot of information on that as well. It's a really good comparison to the rest of the country. I'm not going to waste a lot of time on it, but you see by county the colors. This is a little bit misleading sometimes. It's kind of like the presidential map, not being political, but if you look at it, it's almost all 100% red. But your higher population areas for the presidential election were blue, but you see how the election turned out. Kentucky was 10th on this particular new cases. They have a death rate as well, so you look at the 1 month before and you see it's still trending 2 months before. So if you're into that kind of thing, take a look at it, because it really does provide a lot of information about where we are. Positivity rate, where we are nationally. We're one of the highest positivity rates in the entire country, despite all of the efforts that were undertaken. And then there's also the confirmed and suspected new cases. We're 5th in the country out of all of them. And then the death rate, we are 16th in the death rate. So that's kind of the update I wanted to give you. Just some information. If you want to look at it, it's on the KY COVID website. So some more information about Kentucky, back to more of the legal and what I do. So we talked 2 weeks ago about the veto, and I told you that the veto was coming in. We passed last week and went to this week on our meeting because there were so many unknowns last week. I really didn't want to talk to you about what I think is going to happen, because I knew it was going to be an absolute crazy week last week, and it was. So what happened was the legislature went out of session as long as it could until February 2nd, and on February 2nd, it overrode the vetoes on all of the governor's bills. There were 6 of them. I'm sorry, on all of the governor's vetoes of the bills. There were 6 of them. If you're interested, 2 of them dealt with abortions and some of that issue. One of those he did not veto, but he refused to sign it. By refusing to sign it, it still goes to the Secretary of State. So it was delivered to the Secretary of State. That was Senate Bill 9, assistance to attempted abortions, and it happened if they are born alive, you can't allow them to die. He didn't veto it, but he didn't sign it, and it did become law. The ones that we're concerned about were Senate Bill 1, Senate Bill 2, House Bill 1, 2, and 5. Or I'm sorry, House Bill 1 and 5. So Senate Bill 1 became law on February 2nd. Senate Bill 2 became law on February 2nd because the veto was overridden by about 80% of the House and the Senate, State House, State Senate, was delivered to the Secretary of State. Just a quick overview, Senate Bill 1, executive orders issued by the governor are 30 days unless an extension is approved by the General Assembly. This is to require him to call him into session if there's an emergency in place, because his orders will not continue for more than 30 days. The one thing I have not gotten clarification about, we have orders all over the place that have been in existence for 6 months. This became law on February 2nd. I don't know whether the 30 days triggers from February 2nd, it's the law until March the 4th, or are these now dead because, like the May 11th, 2020 Healthy at Work order, is that dead? Is the mask mandate dead because they're now more than 30 days old? Nobody has addressed that, and I've been trying to get an answer for that, and nobody will address that. My position would be, legally speaking, now I could be wrong on this, this is one attorney's opinion, but the date of that executive order is May 11th. The order, or the law now says, and it is on the books, all orders older than 30 days are void. So technically speaking, I believe Kentucky does not have a mask mandate. I believe Kentucky does not have a Healthy at Work mandate. All of the orders he issued last year that we're continuing are outside of the 30-day period. If I were representing or working with the governor, I would have told him on February 2nd to reissue a 30-day mask mandate, a 30-day Healthy at Work mandate, but I have not seen one. No orders have been issued by the governor, according to his website, since December the 16th. So I'm not positive as to where we stand right now. And that's really shocking that somebody didn't, like his chief of staff, his personal attorney, whatever, or his governor attorney, didn't say, look, we don't agree with this, but you need to reissue or re-up for a 30-day period. The next one that was in there, it's not one we probably need to talk about, but basically you can't, emergency administrative regulations can't be changed. He had basically reshaped some of the boards and voided some of the laws himself, and this didn't allow him to do it. More interesting one is here. So House Bill 1 and House Bill 5. Let me go to 5 first. So 5 basically was, it amended it to remove provisions regarding temporary reorganizations. This kind of went with Senate Bill 2. Basically, the Senate and the House said, wait, you can't basically make law and create administrative policy without going through the legislature. So that's kind of what that was about. The big one was this one. So whoops, and I should have, whoa, didn't mean to do that. So there was this is a typo, don't look at that date. It should have said the last thing was on February 3rd, 2021, because what happened here was this. Veto was overridden on the 2nd. It was delivered to the Secretary of State. It did, in fact, become law. On the 3rd, the governor filed a lawsuit in Franklin Circuit Court in front of Judge Shepard, Philip Shepard, one of the 2 judges sitting in Franklin County. That's where, if you recall, we talked about the 3-judge issue that was brought up to try to change the law, and then they amended that to make it file your lawsuit wherever your damages are against the government, and you have the ability to do that in 120 counties instead of now Frankfurt. Well, the governor lives in, or is residing professionally at least, in the county of Franklin, so he filed the lawsuit in Frankfurt against the Attorney General, legislature, House rep, the president of the Senate, and the Kentucky Legislative Research Commission. He sued everybody he could think of, and ended up presenting that to the judge on the 3rd. In the evening of the 3rd, the judge issued an injunction. So all of this stuff about providing relief to businesses, as long as you follow the CDC, all retroactive to March 6th, suspending interest on unpaid, all of these things, they are all law. However, the one part that says you can ignore the governor's mandates if you're following the CDC guidelines. You can make up your own rules and pull it out of somewhere. As long as you pull it from somewhere that you're allowed to do it in that one location, that's now been subject to this. So this is where I wanted to address. Legislature overrode it. The law went into effect, and then right here, the Franklin Circuit Court judge issued an injunction. That injunction said Section 1(1)(a), B, and C are basically suspended for a 30-day period. That's because this is the emergency action of a court, and I'm not going to go into a whole lot of detail. Basically, he hasn't heard testimony. He hasn't gotten into the weeds, but first blush, does the governor have a strong likelihood of prevailing on any of his challenges? Now, what the governor did was he wanted Senate Bill 1, Senate Bill 2, House Bill 1, House Bill 5, all thrown out. And he asked for an injunction to stop introduction of any of those. The governor rejected that on everything but this one area of House Bill 1, Section 1(1)(a), B, and C. So what that was, the sections allowed, and I boiled it down. If you really want to read it, you can, but it's basically businesses, nonprofits, schools, governments, anybody running something. The House and the Senate said vaguely, you can run anything you want, you can keep it open no matter what, as long as you cherry pick something out of the CDC or the executive directive from the governor that supports you staying open. And what the judge said was, in a nutshell, House Bill, whoops, sorry, trying to move something so I can read it to you. House Bill 1 on its face allows for thousands of Kentucky businesses to make their own rules and adopt their own policies that may be in variance with the duly promulgated executive orders and administrative regulations which have been enacted by the governor to prevent disease and death that is inevitable from the spread of COVID-19. Sounds pretty strong that the judge's ruling, he's going to void part of that law. It just, I mean, that's pretty clear cut. I expect the Attorney General will challenge this by filing an appeal. If you were to ask me my personal opinion is that the House and the Senate, while they're still in session, need to rework House Bill 1 because the law can't be vague and the law can't literally say, let's just let anybody cherry pick any law they want or any regulation or any guidance. And that was the other big thing in the order, was that the CDC issues guidance, not laws, unless they literally, and you're going to see a law here in just a second that they issued. If they don't issue it by regulation, it is simply guidance, and you can't have businesses relying on guidance when there's an executive order from an administrative regulation or an executive order from the governor's office. So it said in the bottom part, this court is concerned with that this portion of Section 1 could create chaos and undermine any effective enforcement of public health standards to prevent the spread of this deadly disease during this pandemic. Moreover, in the absence of injunctive relief, it appears that these provisions of House Bill 1 could likely wreak havoc with public health. That's a pretty strong statement. I suspect the best course of action for the legislature, if any of you on here are listening that are in the legislature, just rush another bill. You've got 80% that are Republican. You can veto whatever the governor does, but put something in place that actually doesn't say go do whatever you want. It's the wild, wild west, which is what they did. It's kind of silly in that one section that said, hey, go cherry pick what you want. An attorney should have looked at that and said, hey guys, this is going to be void for vagueness. Let's rework it. They didn't. It got shut down. It'll be reworked if they get it done before they adjourn for the year, or with their new adopted policies, let the governor issue an order for 30 days, come back into session, which you now have the ability to do, write a new one and send it to his desk. He then voids it or vetoes it, then you override it then. So it's all kind of silliness, but that's the way the law works. So the CDC came out with some distribution, talking about disabilities and the variant strains as well. So I thought I would cover some of this. These are the number of cases completely going on, 26 million cases in the U.S., 41.2 million vaccines, 460,000 deaths, and then they have certain, these are the case trends going downward. So you see there's a downward trend, the deaths are still going up. It's just, I thought it was an interesting stat with the vaccines and so on. I didn't know how many we were going to get from the governor's office, so that's why I had additional statistics on there. But on February 2nd, it was announced that there are now 3 new strains. You probably heard about the UK, but you may not have heard about the other 2. So there's a South African variant, which is different than the United Kingdom, and the Brazil variant. And the Brazil variant is the one that they're very concerned about because it is, in fact, not necessarily responding very well to some of the antibodies in the vaccines that are out there. So literally this is changing before the vaccines can shut it down. So they're trying to figure out whether some of the other vaccines out there can help. But that's where we are with the variants. On the 5th, they came out with a new, and this is law because it is a federal regulation. International travelers must produce proof of a negative test. And international travelers does not mean a foreign person. It means if you go to Mexico, if you go to Canada, if you go to the Caribbean, if you travel anywhere outside of the territorial United States, you must produce proof of a negative test no more than 3 days prior to your travel. Then it's recommended that you self-quarantine upon arrival and that you be tested within 5 days of your arrival. Then they also issued a brand new mask mandate for all passengers, crew, employees, and locations, meaning airports, bus stations, taxi stations, anywhere where, and Uber drivers, Uber passengers, you must wear a mask at all times, whether you're to, from, or on. So just keep that in mind. Into, within, or out of the United States. That's a brand new mask mandate. Vaccine distribution, I thought I would cover that as well. This is on the CDC website. You can take a look at it. It's got a really cool spreadsheet on everything. If you're looking at where we are statistically, basically the rest of the country is really right at this same 16. Some of them are at 19,000 per 100. That's what the government's looking for. Some of the states are falling behind. Now the colors here, just so you know, this doesn't mean that we're not doing our job. These colors were based upon population centers. This is total distribution. So of course, New York, with many more millions of people than we have, has a dark. California, Texas, Florida. That's because they have a higher population center than we do. But this is the key to the map area. They have different maps, but this one just looked prettier, so I used it instead. If I went with one that was based upon the percentage, I could have done that, and it's all dark blue with the exception of Missouri, Iowa, and a couple of other states that have not properly handled their distribution per 100,000. Some of them are down pretty low on this, this right here, the 1 or more doses. So they were a little lighter colored, but it didn't make sense for Kentucky. So, executive orders. Got a lot of executive orders that you guys need to be aware of. Brand new information that affects businesses. I didn't cover all of them, but these are the hot ones that are kind of out in the forefront that you guys have to really be paying attention to. So yes, we talked about it a little bit, but I didn't know the full impact of what was going to happen with it and how OSHA was going to handle it until recently. So on January 21st, the day after the president was inaugurated, there was an executive order put in place. This one required OSHA to take action. It says swift action. Some of them were basically boilerplate, identical to what was in place before. Interestingly, some of it backtracked on some of the aggressive steps that were required under the previous administration. However, this one, it's called an ETS, Emergency Temporary Standard, was directed to be done within 2 weeks. That's the end of this week, or actually that's tomorrow, if I'm not mistaken. It has not been put in place, but it has to be put in place by March 15th. It had to be announced by 2 weeks. We're waiting on that any second now. The problem with an ETS, listen to this very carefully. The last ETS that was put in place was asbestos in 1983. That was the last time an ETS was utilized. The reason? It basically is without any public comment. Right here. Where is it? No notice, no comment, and you're expected to follow it immediately. So what it was is to issue within 2 weeks revised guidance to employers on workplace safety during a pandemic. Sounds fine. That's pretty much what we had in place already. So far, no problem. The problem is that they are to identify any short, medium, and long-term changes that could be made to better protect workers and ensure equity and enforcement. The new ETS will most likely, almost 100%, include a mask mandate in the workplace. The second that it is adopted, it becomes the law, and it has to be in place for it is in place for up to 6 months without any challenge whatsoever, and you must immediately comply. So you need to be listening for the ETS, or the Emergency Temporary COVID-19 Standard, because as soon as that is in place, as an HR professional, a business owner, or anyone involved with a business, you have to have that in place for all employees, all customers, all visitors. Everyone must be wearing that mask all the time unless unless they have a health issue, disability related, and then you're taking other steps to keep them separate. I don't know what this is going to look like yet because it hasn't been announced. But then here is the kicker. Right here, OSHA came out with a declaration, and this is not Trump administration. This is not, whatever anybody wants to argue politically. This was OSHA as a policy came out and said, look, we don't see any evidence that shows that masks are sufficiently protective enough to be designated as PPE. That is a policy statement from OSHA, and yet now OSHA is going to need to put in place an ETS that includes masks in the workplace. Very difficult when it does not qualify as personal protective equipment. So that's going to be an interesting dichotomy. I'm not sure how they're going to handle it. The other one is this one. There is quite a, this is a lot lesser likelihood that in 2 weeks this would be declared, but there was a very strong suggestion that the new ETS would include a mandatory vaccination. If that is done, you're talking about probably hundreds of lawsuits across the country from a variety of different interest groups that will challenge the mandatory order from a federal government. You will recall we had discussions, all the comments about how there was going to be a mask mandate put in place on day one. I said that's never going to happen. The reason was federal government does not have the ability to mandate masks nationwide. It's a governor's prerogative to order his or her state to have protections or not. The federal government is supposed to take a back seat. It's only a safety net. The states control. The federal government is a safety net. So this mandatory vaccination and this mandatory masks in the workplace, those are going to be challenged. Again, an ETS has not been utilized since asbestos. And so you are about to see just an absolute nightmare for businesses trying to figure out, is this something you can do? Are you going to be sued for following it because you can't force it in the workplace? Are you going to be sued because you didn't do it even though it was an OSHA mandate? This is going to be a nightmare because it's an executive order without congressional scrutiny, and it is something that OSHA has already declared masks are not a PPE. So this is getting ready to explode any day. It will become effective at the latest March 15th, and I expect it to be all over the map. So we're going to have a lot of upcoming for you all on a Monday, trying to figure out where do we go next. The next one is with regard, it's only in effect for 6 months. And OSHA has had repeated difficulty adopting anything like that. Like I said, with asbestos. Why? Because you literally have to prove that employees are exposed to grave danger without the specific direction being required. And so if OSHA has already said masks are not effective enough to be PPE, then how can they prove that wearing a mask or not wearing a mask exposes you to grave danger in and of itself? So that's the problem they've got. Next executive order that creates a problem for you as an employer, and this is a huge one. So the executive order says specifically that the Department of Labor is to issue new instructions to state unemployment offices to allow for people to become unemployed voluntarily because of a self-described fear of working in a particular environment due to the pandemic. It sounds fine, but this is the explanation that was given from the White House. It says, quote, workers should have the right to safe work environments, and no one should have to choose between their livelihoods and their own or their family's health. There has been zero follow-up to this yet from the Department of Labor. However, employees are entitled to an additional, not $600 now, but $300 on top of the, if you're in Kentucky, maximum $552, or if you're getting a minimum $1, in unemployment, you will receive an additional $300. So the problem is this. Number one, they're going to get $300 extra from the federal government on top of state unemployment to do nothing. Number two, the executive order does not describe any criteria to determine who's eligible for any of these additional $300 benefits. Number three, anybody at any point in time, if you're getting ready to discipline them, all they have to do is say, you know what, I really am uncomfortable because I'm really afraid I'm going to get COVID. And they can walk out and they're going to get unemployment at whatever rate they're supposed to get plus 300. Or even if you want them to come back to work, and we had an example at the very beginning of COVID of people in a construction site. There was work to be had, and they're like, you know what, no, I'm going to stay at home, I'm going to collect my unemployment. Now, you cannot challenge them on unemployment. Why? Because there is literally an executive order from the federal government that says every private employee has a right to be afraid to go to work and a right to collect $300 a week from the federal government in exchange for not going to work. Now, they can basically go into the unemployment office and say, I'm afraid of going into work because I might get COVID. Because my mom, because my dad, because me, because I'm around people in my church, because I don't know what this is going to do. Literally, they're going to get $300 extra from the federal government to stay at home. So if you're trying to run a business, you're running a restaurant that's struggling, you're running a factory and you can't get enough work, the $300 extra from the federal government per week is going to create a huge problem. Also, there's an effort to extend so that this won't expire at the end of the Consolidated Appropriations Act, which was the end of March. This will be extended to $300, and so there's a whole lot of unknowns, but I suspect that our unemployment, the Kentucky Unemployment Office is going to be 100% bankrupt because of this, because there's no way that they can continue to pay unemployment benefits plus the 300, plus the people who are on extended, plus, and it just basically allows a subjective fear-based declaration. There's no ability to challenge anybody now. So there is some guidance though on one thing. This is I found this case. It's a year old, but in the legal world, that's new. It's only a year old. This is a Fifth Circuit, so this is not Kentucky. That's Texas, Louisiana, and Mississippi. However, this is one step below the Supreme Court. It's a pretty well-respected circuit. I've told you in the past, the Ninth Circuit, I call the Ninth Circus. That's California. They come up with some of the most wacky decisions that make no sense at all. They are the single most reversed court of appeals in the United States, and it's a ridiculously high level that gets thrown out by the Supreme Court. The Fifth Circuit's pretty conservative and I don't mean that politically, I'm meaning in terms of their decisions are very well versed, so they don't get reversed very often by the Supreme Court. So Fifth Circuit came out with a decision a year ago. Now this was about religious discrimination, and this related to a Tdap, which is a tetanus shot. However, it's very timely for you all. This is a good guidance for you to keep in mind because of the brand new religious discrimination that we talked about 2 weeks ago, and because of the vaccines that are going on right now and the problem that you may have with regard to distribution of vaccines. In a nutshell, and I'm not going to read it all to you, you can pull up the case if you want to, you can ask me if you want a copy of it and I'll send it to you. But basically what this was a public fire department that said, look, you're going to be around people that may have certain, I'm sorry, it wasn't tetanus. I know, don't start putting in the chat. This is basically, this gentleman did not want to have a vaccine because he's a religious minister, but it relates to communicable diseases, and he wanted to only wear a mask when he might be around someone that had that might have tuberculosis, that might have some type of respiratory illness, and they said, no, we will do one of two things. We will either reassign you, or you can remain in your current position, but you have to wear PPE all times, 24/7 while you're on duty. The employee rejected both. He wanted to do something else. The employer said, nope, we've given you two options. You can either be transferred somewhere else at the same rate of pay, or you can wear your mask 24/7. He refused. He was terminated. He filed a lawsuit. And basically what the Court of Appeals, both the District Court and the Court of Appeals, said that the city has a right to identify its own reasonable accommodations. The employee does not have that opportunity to choose their own. You don't have to follow the employee's individual. You can do something that's reasonable. However, the city did promptly review the request, identified options, presented those to the employee. The law does not require employers to adopt the specific request being made. So that's the key fact there. Make an accommodation for your disability on your vaccines and your religion. Stick to those, but make sure you have done an adequate job into looking into those before you do them. That's what this stands for. OSHA came out with new guidance on January 29th. New guidance incorporates existing OSHA and CDC and also provides these. Number one, OSHA is now here's the problem. If you don't follow OSHA recommendations, you get into trouble. So OSHA is right now recommending all workers that you provide all workers with face coverings, cloth face coverings, surgical masks at no cost unless their work tasks require a full-blown respirator. So this is the first step to having a mask mandate. It's very close. If you don't follow it and one of your employees gets ill, guess what? You have an OSHA investigation into why you didn't follow a recommendation from OSHA. Number two, they now recommend that all individuals at the workplace, visitors, customers, non-employees, are required to wear a face covering. Only small certain exceptions. Guess what? If you don't follow it and one of your employees gets ill, you're going to have an OSHA investigation. Then they also touched on, but did not yet require, vaccinations by recommending that employers make vaccinations available to their employees at no cost, and that employers ensure vaccinated workers continue to follow all protective measures. This is a little bit of a concern because it's going down that path, but it's not providing it as a regulation, it's just providing it as guidance. Problem is, OSHA guidance means if you don't do it, you're going to be in trouble. That's going to be a problem. So keep that in mind. Start trying to make your changes. As I told you, the administration changes with OSHA now having a new head will create a lot of problems for the employers that are trying to keep up with things because these rules are coming fast and furious. So just be aware that you're going to get a lot of changes to your requirements in the next few weeks. All right, PPP. If you're a shuttered venue, I'm not going to spend a lot of time on this, but basically if you're a theater, museum, living arts, movie theater, live theater, any kind of live venue. That includes wedding venues, talent organizations, that type of thing. Basically, there's a brand new Sba Guidelines out. The grants are not yet available, so they just said, hey, we're not ready to announce, but start getting your DUNS number, start filling out your application, make sure you're on registry with the sam.gov. Takes 2 weeks or more to get your application started or get your information started on SAM. So you need to go ahead and start doing that now. They will be announcing it sometime soon. They don't know when. That's all I got. Another PPP update. AICPA has demanded information or requested information from the SBA because a lot of companies are having huge problems. This is a big issue right now. If you're one of these, this is for you. If you haven't had any problems yet on your second draw, or if you're a first draw participant, congratulations. because the SBA.gov website built a brand new screening procedure to try to catch fraud. The problem is that they are rejecting a tremendous number of people that don't have fraud. Then they're requiring documentation. There's some kind of glitch that's basically accusing people of a crime, and then there's no explanation for how to fix it. So they've asked for, how do we get through this? Wait, stand by this week, because the SBA usually responds to the CPA group, because CPA group is filling out a lot of these applications. So the E-Trans flagging 20 to 30% of all of the applications right now. It's rejecting them with an error code, then it's not providing with a solution. I don't have any more information for you other than you're not alone. 20 to 30% is a high rejection rate. Keep pushing your bank because you're running out of time, but it's still a problem for a lot of people. Also, the SBA is capping loan amounts, and some of those are reducing the approved amounts without explanation, and that's creating a problem for a lot of first time, because as you may or may not be aware, the application the second time around is not the same as the first. So you can get up to 10 million first draw and a lot less on the second, but yet the system wasn't built to distinguish between first and second. So there's an error going on with rejecting those. Keep applying, keep pushing, because your bank can eventually get through, but it's going to be a nightmare. Also, the last thing they said, which I kind of laughed at, was because the first time around we had like everyday updates and requests and so on, frequently asked questions. So the AICPA said, hey, we need communication on available funding, overall processing, and timing. It's critical, and you're not helping anybody because you're basically sitting there on your thumbs not doing anything. SBA has approved 900,000 loans, $72 billion from January 11th through the 31st, and left approximately $212 billion available. Applications close at the end of February. If you haven't gotten it started, get in and start getting it done. So that's the PPP update. IRS issued new guidance with regard to the employee retention credit, the ERC, and the PPP, and it's still a complete nightmare because they didn't explain a whole gamut of things that need to be addressed. However, they did issue 2021-21 explaining that the ERC was extended and amended. The extension included an increase from 50 to 70% of qualified wages. The limit on per employee wages went from $10,000 per year to $10,000 per quarter. That's a huge change. The reduction in the required year over year went from 50% to 20%. Safe harbor, that talked about the gross receipts to determine eligibility. It allowed governmental employers to claim the credit, and it increased from 100 to 500 employees counted, which is good. But then the one thing it didn't address was those who applied for and received forgiveness on a PPP. A lot of you on your forgiveness applications went in and said, it doesn't matter whether I put in, and I literally got these questions, and now it matters. That's the problem. Everybody, and there was I think on our call 2 weeks ago, there was a question about this. Well, it matters now, because the issue was this. If I'm using 100% of the PPP, more than that value, on my employees, do I need to submit the rent and the other qualified expenses, or do I just submit it? Well, now it matters, because you can get the the employee retention credit plus the PPP, but the question from the AICPA and the question on challenging this has been, well, wait a minute. If we submitted an application and we included some of these wages in our PPP request, but we didn't need it in the PPP. In other words, I had enough rent, I had enough utilities, I had a whole bunch of other things, but I just threw it in there because it didn't matter. Can I still claim the ERC if I use those figures in the PPP? No answer. So this is kind of all over the map. If you have not yet done your forgiveness, reduce as much as possible the wages down to the level that you can so that you can still claim your ERC. If you don't understand any of this, I don't do my own taxes. Please don't ask me a tax-related question in the chat session. I'm just reporting to you the legal aspects of this. You need to get with an accounting company that can help you or an accountant that can walk you through this. It is a nightmare if tax people can't figure out what the IRS is talking about and why they did what they did with the PPP. Good luck figuring it out yourself. So, that's it. How far did I go?
Good work.
Hour and 22 minutes, including the governor. Woohoo!
Or Jim Gray, anyway.
Governor's
Hey,
office.
here are the codes. Here are codes for HRCI and SHRM. I think we've kept up with most questions. If anybody has any, please fire them off to us. Thank you for staying with us this long. Some people had to drop off, but gosh, we're so glad that a lot of you did stay on. We're want to keep providing this information because we hope it's helpful. And any final questions? Jim, have you looked over the chat box there?
Yeah, so there was a question about the number of weeks in Kentucky. I have not seen any change in the law. The only adopted laws so far are the ones that I talked about before. So to my knowledge, there is no extension on Kentucky, but keep in mind there was the federal pandemic unemployment insurance. Don't quote me that that's the right name of it, but it basically said that if somebody rolls off the number of weeks eligible under state, that there's an extension to that under federal, so you can still get unemployment under federal law if you rolled off the end of the eligibility under state law, so you need to look into that. Also, there was a question, a couple of these are private, I'm not saying the name, don't worry about that. There's a question about small employer exception to OSHA. Honest to goodness, I know there is, but I don't recall what it is, and I don't want to misstate it. OSHA is pretty stringent on it. It pretty much is any employee, but I believe there's a small exception. I'll look into that and see if I can put that into the follow-up email that we send out, thanking people for, I'm making a note. The email that Autumn and Chase send out sometimes saying, thanks for coming, here's the link. I'll try to see if I can put something in there. And one other question was the guidance on PPP2 loan forgiveness with regard to the 8-week or 24-week when it begins. Not much guidance out there other than what's in the law. It's a lot more loose on the 8-week, 24-week. I think you get your choice, but there's not a whole lot of discussion out there about it. Quite honestly, I've been amazed. I don't know whether it's just accounting companies and law firms just going, you know what, we're exhausted from keeping up with that, and I get that, because this takes, you have no idea how long it takes to try to boil down all of these different announcements. I mean, like the CDC alone, there, between the last time we did this and now, there were like 125 announcements, and I had to go through those to see, are any of those really worth anything, or are we just wasting time? Then there's the OSHA, then there's the SBA, then there's the IRS, then there's the Kentucky COVID, the Kentucky vaccine, the lawsuits, I mean, it is exhausting, but I have been absolutely astonished since the end of December, the number of locations of companies, because I would check, I'd see what other law firms are doing. Is anybody else, are there any other blogs keeping up? I've got a blog, by the way, that my office does. Tyler does an incredible, my son actually, does an incredible blog. He's keeping up with all these things, doing a really good work with it. There are no blogs. There's no information out there right now. It's few and far between, and I've been amazed. I don't know why nobody's doing it, but it's making my job harder and harder to keep up with it because there's less and less people talking about it. But The number of people on your call, Lyle,
Yes.
the number of emails I'm getting, the number of concerned companies, I'm really pleased that we keep doing this. And I know it's exhausting sometimes for your group and mine, but it's needed. You all need this right now more than anything, with all of the executive orders from the governor to the president, all of the changes to the administration going on that impact companies, and all of the new things coming out with the PPP, the taxes, the ERC. It's astonishing to me that nobody is leading on this. So we're going to keep doing this, and we're going to keep, we talked about switching, Lyle and I did, about switching to other things, other topics, other legal things. The reality is this is what you guys need right now more than anything. Vaccine distribution, what do I have to do with the vaccines? How do I get more money? What am I required to do with masks? Those are all critical. And so we're here to help. Lyle's group's here to help, and we're not going anywhere. So it's good work, Lyle. I just wanted to throw in my 2 cents. I think this is critical for everybody.
Thank you. Yeah. Hey,
Any other questions, let me know.
Yeah, we'll keep the line open for a few minutes if people want to ask other questions, or I don't mind dropping the photo and putting people's picture up and they can say hello. We keep trying that. Not many people do, but I think it's kind of fun when they do.
Hey, and I see